Welcome to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Dr. Michael Betler. He is a double board certified surgeon, shifted from general surgery to osteopathic and lifestyle medicine. And we'll learn about his holistic framework for keeping active bodies in motion, applying hands on osteopathic principles, shockwave therapy, peptides, and magnet theory, not as isolated treatments, but as integrated tools for proactive healing. Welcome to the show, Dr. Michael.
Thank you very much. It's great to be here.
You are welcome. Welcome to the show. Welcome to India in this online form, Dr. Michael. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll talk about mobility. We'll talk about regenerative medicine. We'll talk about all that you talk and do. But before that, let's talk a bit about your background, your journey, so that the audience knows who they are listening to.
Yeah. So I wanted to have a good background just in case I didn't get into medical school. And my dad pushed me to go to where he went to college, which was Carnegie Mellon in Pittsburgh, Pennsylvania, where I grew up. So my background and way of thinking is engineering. I did chemical and biomedical engineering as my initial bachelor's. I went into osteopathic medical school, which at the time I didn't know, but the principles and the philosophy that carries through with osteopathic principles is that the body has an inherent capacity to heal itself. So I really like general surgery because it kept my attention. I was really good with hands-on stuff. So I wanted to use my hands, see kind of fast turnaround of healing. So that was why I went into general surgery. Plus it was very diverse. I kept up with the osteopathic principles and training all the way throughout medical school and in my residency. And I was big in sports when I was younger, active throughout my adult life as well. So one of the things that was always in the back of my mind that I actually had thought about initially was sports medicine. And I had utilized and employed my osteopathic training for family, friends, people that would come in and out of town for various things that had pain points or something like that. And I would see it help turn people around pretty quickly. One friend from Germany actually came in for my little brother's wedding and couldn't move, had trouble walking. I did a realignment on him and he was dancing out behind the Hard Rock Cafe that night. So the basic symmetry that's employed in osteopathic medicine really can make some big differences. And I created this practice with my wife, who's a physiatrist, and our friend who's a massage therapist, to kind of hit multiple points and have additive care benefit people from multiple standpoints. And because of my background in engineering, I always wanted to add in technology and evidence-based technology, not putting in things that are kind of gimmicky and have no research behind them. So I employ focused wave therapy and radio wave therapy, which are two different types of shock wave to increase the body's healing mechanisms and fix bones, tendons, and muscle tears and things like that. Magnet therapy is additive to that as well. And then since our first contact, I've actually added in red light therapy also. I've hired a partner who does dry needling. So we have multiple modalities that really try to get the body to heal itself. And then partners in the community. So we have people that do stem cells and PRP in the local area as well. So if somebody isn't 100% healed with what I do, then I have options to send people out. Partnerships with insurance-based physical therapists as well is very important because there are a lot of physical therapy groups that are moving towards cash-based models and not everybody has the ability to afford that.
Absolutely. Absolutely, Dr. Michael. So let's understand it from a common person's perspective. They know about doctors, they know about surgery, they know about medicine, they know about everything else. But not everyone knows this osteopath thing. Like, some people might know, several may not know. So I want, to help people understand about osteopath. Who is an osteopath? What does an osteopath do?
Yeah, so So an osteopath is a physician. We go through the same residency programs as MDs, allopaths. So we've gone through a lot of the same training, but we also have in our training, um, not to exactly compare to chiropractic, but chiropractic base. So we can treat things from a hands-on standpoint. So I've had success treating constipation, for instance, headaches, sinus issues, and then a whole range of musculoskeletal issues. So our principles as far as the treatment of osteopathic manipulation adds in a base where you can calm down the gut, for instance. So as a general surgeon, my senior paper, I did a study on people that came in with bowel-based emergencies, so perforations and things like that, where they needed operation. And we had a group where there was a control group who we did nothing and just did our usual care. And then we had a group where we did osteopathic manipulation, which was very basic things like rib raising. The goal of these basic things is to get the nerves that stimulate the gut to wake up the gut faster. And we found that we had people out of the hospital 2 days faster with the basic osteopathic manipulation because we could decrease inflammation. There are definitely research studies that show that CRP inflammatory markers are decreased with osteopathic manipulation. So getting the body back to a base where it's in an ideal composition to heal itself and get better from whatever is kind of assaulting it.
Absolutely. So, from a common person's perspective, if I understand it correctly, and if I'm incorrect, do correct me there, is that an osteopath has more, flexibility in terms of within the parameters of medical science and explore more methods of healing several things. Am I understanding that correctly, Dr.
Yes,
Mike?
absolutely. Absolutely. So that's the goal, a holistic care, approaching it from multiple standpoints, not just seeing a disease process and giving medicine or doing surgery to treat that, seeing what's the patient's home life like. Are they mobile? Are they active? Do they eat well? Do they exercise? Did they optimize themselves for their life in general? And one of the things I was running into in surgery that I really wanted to change was that the majority of American diet is not great. So you run into a lot of things like diverticulitis and gallbladder issues, where a lot of this stuff is preventable if you eat well, exercise, and have good circulation to a point where your body will get to where it wants to be. The body doesn't want to be inflamed. It doesn't want to be overweight. It wants to have an easy time on the joints. So having a good base of eating well and exercising gives you an up. And I definitely have seen in practice where people that were healthy or would definitely do well in post-op recovery, and they were always more motivated as well to get up and move and get back to what their base function was.
Absolutely, Dr. Michael. So, to understand your importance in the right way, when do you come into the picture? Do you come as the first resort or the last resort? How does that work?
Yeah, so it varies. I mean, people that know about osteopathic medicine, definitely they'll seek us out as a first resort. But I've definitely at my clinic had a lot of people who have gone through physical therapy, who have gone to orthopedic surgery, who have gone to primary care, have pain medications, injections in their back, and nothing has really improved them. So they come here and we kind of look at it from a basic standpoint. Is your pelvis in line? Is your back in line? Are your muscles inflamed? And try to hit it from different standpoints. So doing realignment for back pain, I've been able to get sciatica. So sciatica is something where the low back is out of place. There's a nerve that runs down behind the buttock, down the back of the leg. So when that pain goes down the back of your leg, that's sciatica. And a lot of times just getting realignment, even once, I've had people that have had sciatica for years come in, get a realignment, and walk out without issues. So just seeing from a different perspective and knowing what's there. So the big part of what we try to do with our practice is visibility and getting our name out there and going out to the community and talking to people and saying, this is who I am, this is what I do, this is what I have available to you. So this even for athletes, so if somebody gets injured, there's a thing called the recovery gap where basically you'll get sent to physical therapy to heal a non-surgical option or non-surgical injury. And we have options to speed that along. So people that have 6 to 8 weeks of physical therapy, we can a lot of times in conjunction with physical therapy, get people better in about a week or so. And I've had athletes that are seniors are going to have their last season that want to keep playing through the season and want something that will help take the pain away temporarily so that they can stay at their optimized performance. And we're able to do that and get them through the season. They may need something sometimes after the season that they didn't necessarily see, like a small tear in a joint capsule or something like that that needs fixed. But that, for instance, we can make sure that people are able to do what they want to do short term and most of the time long term.
Absolutely, Dr. Michael. So, in the general surgery, or before coming to it, it's not that they have they have short of understanding of things, but it's the perspective that you bring. That is where I guess, it matters most, and you have the expertise as well as the training for that. If I understand it from that point of view, if that is the case, help us understand what are the tools that you employ, and that you bring in. They look at perhaps only one part of the body, only that part of the body. You can look at it holistically and look at the whole body as such. So in that aspect, what are the tools that you employ, and earlier on that was not. Give us some examples for people to understand, that same case looked by other experts, but with the perspective that you bring, it changes everything.
Yeah, so I'll give you an example. It's winter here, so obviously sinus issues are a big thing, right? So sinus issues, if people have infections, the first thing that people typically do is they'll do antibiotics, or they'll say take anti-inflammatories for a couple weeks, and then if it's still there, we'll give you antibiotics. So from my perspective, approaching it from a nerve and inflammation standpoint, I treat the neck, upper back, and head and direct pressure on the sinuses. And a lot of times we do treatment every 2 to 3 weeks. We can get those sinuses to kind of stay at bay when people have allergies and things like that. So the nerves that innervate the head and the face that make those sinuses overactive, a lot of times are in the top 5 vertebrae of your thoracic spine. So like the base of your neck down to the mid chest. So getting the back decreased in inflammation, getting the muscles calmed down, making sure everything is even. Treating also the first rib. The first rib can rotate, and there's a lot of nerves that go through that area, and that's a big drainage point for lymphatic flow, so healing fluid as well. And then getting the neck, the base of the skull. The base of the skull is very important because that's where the spinal cord comes out, so you want to have good flow through there as well. And then pressure on the face, right on the sinuses, because the nerves come out here, here, and here. It's important to get those calmed down. So very commonly when people have sinus issues, you'll feel what's called bogginess, or actually fluid in those areas that you can kind of push out so that the nerve can calm down and say, okay, I'm not angry anymore, and I won't do what I was doing. So there are ways to get things to calm down that, like you said, just from a different perspective and a different approach, may not cause as many issues, like antibiotics on the gut. People take antibiotics, some people just can't tolerate them and get a lot of cramping, diarrhea. And a lot of times we try to avoid as much as we can medications, but everything has its place, right?
Absolutely. So that is where you use different principles. You talk about shockwave therapy, peptides, and magnet therapy. Help us understand from that place. How do you decide, okay, which one is the best to use? How should a common person understand it, so they know, okay, my chances of recovery is there beyond the medicines that is available or that they know about. Someone like you improves their chances just by the perspective and the expertise and the training that you have.
Yeah, so from a musculoskeletal perspective, which is my favorite, I grew up on sports. I played soccer, baseball, football, wrestled, through shot put and javelin. So I'm in my 40s right now, and I kind of destroyed my shoulders. So 2 or 3 years ago, I was not able to do push-ups, and part of what I have as a practice is what's called focus wave therapy. So basically what focus wave therapy does is it puts energy into the tissue, and that energy going into the tissue helps your body to increase osteoblasts, which heal bone, fibroblasts, which heal tendon, and decrease the inflammation in the area, and even stimulate blood flow while the healing is going on. So I was able to fix that on both sides pretty quickly, and able, after 3 treatments over a period of 3 weeks, get back to the activity I was doing. And now I'm able to lift like I was able to lift in my 20s and 30s again, and work out. So the experience that I have when people come in with certain things, if it's back, I almost always start with realignment. But some people want dry needling or magnet, which are two things that can get the body to calm down as well. Dry needling, you put the needle into a muscle and basically say, kind of, you overwhelm it until it calms down. You get to the main pain point. Magnet therapy is something that pushes out inflammation at a cellular level. By pushing out inflammation and things that make cells angry, you give the cell the ability to heal itself and not be painful, basically. And I have had soccer players, young soccer players, who have come in with back pain because they're rough on their body, that I've done realignment and the magnet for, and now over even just 2 or 3 treatments, I've had them back to full activity and watching them, bounce onto the soccer field and like nothing happened. So, whereas somebody else would have said physical therapy for 6 to 8 weeks, something else, so trying to get people as active as possible, as optimally as possible, with tools that can speed healing as fast as possible is the goal of what I do. In recovery, we call our practice CT sports recovery, because recovery is really a very, very important part of training. So the practice, the lifting, the running, people abuse their bodies in the name of getting better at their sport, or playing pickleball, tennis, even just for fun. So my goal is to get people to recover and make sure they know how to recover. And there's very important adjuncts as well. So we also advise on physical therapy. We advise on stretching is a huge thing, because not a lot of people stretch very well. Posture and core training is extremely important. Nobody focuses on it very much at all. And then even yoga. I love yoga. I've always loved yoga, and I think it lengthens your muscles. It stretches everything out. It teaches you meditation and breathing. And there's so many good things contained within maybe just 2 days a week of yoga that can really reset your body and your inflammatory markers and everything as well.
Absolutely. So when you talk of mobility, Dr. Michael,
Yes.
help us understand your understanding of mobility that you want people to understand.
Yeah, so I think mobility is different probably at every level. For somebody that is older, it might just mean walking without shuffling and having less risk of tripping and falling. For someone that's younger, wants to be able to, touch their toes, do whatever else they want to do without feeling like they have an issue or restriction on one side. And I know, like, so one story I have is a patient who was a 70-something-year-old female, avid golfer, loves to walk on the course, but was having decreased ability to walk on the course. So she has a wheeled bag carrier, but she could only get to about 14 or 15 holes before she would have to stop. So she came in, and I was able to get her back just with realignment, with doing full 18 hole course, and she was very excited about that. The other thing that was a byproduct of that was that she added 30 yards onto her drive, and the reason is because she was restricted. She probably was not able to twist forward as much, and by getting that extra twist and realigning everything back to a baseline, she was able to enhance her game even more than I had thought initially. So there are things that happen just because of getting the body back to symmetry and getting it back to a place where it can move fully. So for her, that full range of mobility on the swing was the mobility. So it does mean a little bit different to every person, but we try to get people back to whatever level of function they want. And ideally for me, I'd want to get them better than what they came in with and where they desire to be.
Right. What is the who are the major patients for you, major that constitute? Is it athletes or general people? How does that work? You talked about, because injuries that you talk about, is it more about sports injuries that you take care of, or is it about general people who may not find that respite in general surgery or anything, and then they come to you? I want to understand that from that landscape.
Right. Yeah. So ideally, it's both. And another perspective that I have is I have 4 kids that are in club soccer. So very active, practice all the time, games all the time. So that whole youth, middle school and high school, they want to play all the time. They don't want to be hurt. They don't want to take off, because that's also their identity. They are soccer players. They're baseball players. They are football players. They're tennis players. They want to do that sport, and they want to do it at a high level in this area. So that population, we serve very well. And a lot of times those people are where we employ a lot of shockwave magnet and things like that because they're trying to stay active and get active. Um, I'm a little bit more selective in the shockwave and magnet depending on where the injury is in the older population, but the other population that we serve is the 30s to probably 60s, where you have much more emphasis on activity these days and preventative medicine, where activity, diet, everything is extremely important to make sure that you can do whatever you want. People want to stay active. People want to be outside. They want to be mobile. So getting those people in is our other focus, where I want to keep the parents of those kids active and make sure that they can keep up with their kids, make sure they can do whatever activities they like, because the activities that they like may be more different from what their kids are. I know for me and my wife, we practice with our kids and we try to keep up with them. It's getting harder and harder every day, but we do everything we can to make sure that we can keep up with them and we can train them and we can do a little bit of the things that they do.
Absolutely, Dr. Michael. You talk of osteopathic manipulation.
Mhm.
Help us understand that part. You stretch people beyond their natural. I'm just trying to be, understand from that. How does that work?
Yeah, so the goal would not be to stretch them past their natural restrictions. So somebody comes in with so think about the pregnant mom. Pregnant mom, obviously pregnancy kind of wreaks havoc on your joints, makes everything loose, puts everything out of the place. After she has the baby, she's carrying the baby typically on one side, or somebody carries groceries all the time on one side. So you're stressing your body unevenly pretty much all the time. So basically what we do is we try to get everything back to balance. You don't necessarily have to have pain, and I have people that come in that just want to be realigned, maybe mild scoliosis, and they get back to normal. So the goal is for me from the base up, and the base is the pelvis. Pelvis sits on the bottom. You have the sacrum in between the pelvis, and the spine sits on top. So if the pelvis is off, you're twisting the sacrum, and that means everything else goes off on the top of it. So that's why everything's connected. So you have to fix the whole thing. So the base, the sacrum, lumbar spine, thoracic spine, cervical spine, and then anything that's inflamed up top. And sometimes we do cranial manipulation too, if people have migraines or anything that's going on up top. So it's really a whole body approach because the body is interconnected at every level. And people that have neck pain, have headaches at the base of the skull, a lot of times you have to treat the sacrum too, because there's a fascial or a connective tissue plane that goes all the way from the top to the bottom, and getting everything loosened. If you don't loosen the bottom, then and you have some inflammation that you're not aware of, the top is not going to get better. So it's making sure that you see things, you see where people's restrictions are, and I'll watch people walk in my office and even outside all the time, and I can kind of tell where they have pain points. So like ankle pain, hip pain, things like that. And I don't approach everybody, but I want to, and tell them like, look, I see that you have this. I'd love to help you. Come in and I can do an assessment, and I can tell you what would be optimal to try and get you better and make you feel like you don't have to walk like that, or you don't have to be in pain every time you step down the stairs,
Right, doctor. So, in your practice, how much medicine do you require, or is it more of with the things that you can do with hands, with your suggestions, with your realignment? Does that work most of the time?
Yeah, so the hands-on treatments work most of the time. Our goal is not to prescribe medication. We actually don't prescribe pain medication. I use more heat because heat dilates the blood vessels, and if you want healing, you need blood flow. So heat, electric blankets, things like that are very good for healing. Ice is good for the first 24 to 48 hours to keep the swelling down, and then heat all the time after that. Epsom salt baths are another great way to do it, or an Epsom salt soak for a foot or ankle or wrist injury is another good way. But we have steroids for injection here if we need it, but we try to employ everything else we can before going to something like that. So just a simple steroid injection doesn't fix anything. It decreases inflammation. So sometimes things don't come back after a steroid injection, and the inflammation will stay down, but you're not healing the base issue. You're not fixing the arthritis, the impingement of the tendon that led to the issue that was there that needed the inflammation. So we try not to use medications because unfortunately medications are not a fixing component of what's going on.
Absolutely. Is your work only possible or on site, offline, or online? People can also benefit from you, Dr. Michael.
Yeah, so I'm actually developing with a colleague that's trained in myofascial movement. So she's going to be doing online therapy for people. So I think over the next month, that's my next project, is to get her up and running and make sure that she can do that for people. So that would be a class where, so she had scoliosis, for instance, and through learning how to move, how to bend, how to relax her connective tissues, she was able to get around and kind of straighten things out. So having that online ability to help people for me is very important. So that, and then on our website we do have some videos. So core strengthening, posture strengthening, and pelvic floor and breath work that people can go to. And it's just, you just have to create and put your email in so that you can have access to all of those. But we do have online options for sure.
Absolutely. Because why I ask this, places like India and
Yeah.
other places across the world, when they learn, at least that will be another window for them to look at options possible from another part of the world with people like you and get the best help possible, suggestions, some sort of an opinion as well as help. You talk about, let's come to the regenerative medicine part, or you talk about regeneration quite a bit, if I understand correctly.
Yeah.
uh, in general medicine, the medicine that day to day the regeneration is talked about, but not in that same enthusiasm. A lot of things are understood the way medical science understands it today. How do you look at the regenerative ability of the body? Help us understand from that point of view. How should patients understand it? And how do they go about using that regenerative ability of the body without also interfering with what our medical science says?
Yeah. So one of the best regenerative capacities the body heals is the sleep cycle. Um, Getting a good steady sleep cycle is very important. So the base of lifestyle medicine: diet, exercise, proper sleep schedule. So those are the three things that anybody can do at home. So as far as eating whole foods as much as possible, avoiding fried foods, Mediterranean diet is really one of the best low inflammatory diets. Making sure you get a good mix of fruits, vegetables, and things like that, using things like blueberries, which has a ton of antioxidants, strawberries, which can help to decrease blood pressure, um, kale and spinach, which help to heal the gut because it's feeding your gut bacteria. These are all important things from a dietary perspective. From an exercise perspective, again, mobility, core and posture strengthening for me are probably the biggest things to make sure that everybody has kind of what they need. And I personally think that yoga for me had kickstarted my journey into wellness. Again, I've had a couple of forays away from it, unfortunately, but that really got me back into knowing my body, knowing how I move, being able to stretch, and being able to get to a point where I wasn't inflamed during my movement. And then sleep. Ideally 7 to 8 hours a night. You want to get it at this as close to the same time for sleep and wake up. Your body's growth hormone goes up at night, so growth hormone is very important for recovery. You want to get all those things in place so that your body has its ideal situation. If you have sleep issues, it's important to see someone. Take like a chamomile tea or something at night to try and get yourself to calm down. Ashwagandha is a great supplement to help sleep at night. L-theanine is another one for people that may not have access to a physician or somebody to help them. I don't like some of the newer things like Ambien and Trazodone because they don't get that good sleep cycle in. But they will help you rest, but not recover really, because it's interrupting that deep sleep cycle. So those are the base. And then the regenerative things I have at my practice are realigning the body so the body has good nervous spinal fluid flow, good drainage flow, like of blood and of lymphatic fluid, getting the body to a point where the blood flow to each area is optimal. And then enhancing that with things like the shock wave, which enhances blood vessel growth, enhances healing factors. Magnet, again, decreases inflammation, pushes everything out. I just added red light therapy as well. Red light therapy helps with blood flow, enhances mitochondria everywhere that you apply it. So enhancing mitochondrial processes enhance longevity and enhance healing as well. And then things like PRP, stem cells, the people that I send to for that, those are the same idea. You're putting things in an area, where the body can use its growth factors to basically heal itself. So there's options out there that at the base you set yourself up, and at an accelerated level where you go to the physician, we help to speed things along. But setting yourself up is just as important as coming to somebody like me and making sure that you have the options and the choices of healing mechanisms.
Absolutely, absolutely, Dr. Michael. There is so much to learn about all this from you, and I'm sure a lot of people would like to understand more about this, more about you and the way you do things. Perhaps get your help and be take from any part of the world if possible. As you said, so many things that you are doing. What's the best way for them to do so?
Yeah, so our website is ctsportsrecovery.com. So go on there and take a look and see what we have available. We do have some blogs that we put up as well. So as much information as we can get out there, and come back to it. I'm always trying to develop. I'm always trying to bring something new. Like I said, I'm trying to develop this remote um, stretch fascial training for people that might have scoliosis or low back pain. They can't get somewhere and can't get into an office. So ideally we'll be able to reach as many people as possible, get our word out to as many people as possible, so that when people think of, oh, I just hurt myself on the field, I don't have a fracture, I don't have something that needs surgery, let me go to this practice and see what they can do for me, because I know they've helped some of my other friends in the past.
Wonderful. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for
Thank
joining
you.
us.
Thank you very much. I had a great time.